PHN is doing this amazing work whereby we're looking at the whole Hunter, New England, Central Coast area and looking at what's needed in the different areas. We're doing a large range of scholarships, so covering admin, diabetes educators, women's, GPs linking up with specialists.
My name's Bron, I'm a registered nurse at Raymond Terrace Family Practice, involved in setting up a diabetes clinic here, but I was also lucky enough to receive a scholarship from the PHN to help me with my certificate in diabetes education and management. That helped me be more focused applying for this job because the job is purely dealing with diabetes clinics, setting up a diabetes clinic, screening for pre-diabetes, which is also a really sort of important part of the role. Without the scholarship, I wouldn't have applied to do the course because it was just beyond what I could afford, but that covers half of the fees, which is a really good opportunity.
I'm Heather Maley. I work for a Wabakoo Aboriginal Medical Service as a nurse for chronic and aged care. I work over in clinical as a diabetes educator. I'm working towards my credentialing as a credentialed diabetes educator. I've been lucky enough to receive a scholarship from the Primary Health Network to assist me in that process.
My name's Elaine Cornford and I'm a practice nurse in Cardiff, and I recently got the Primary Health Network scholarship to help get me through the diabetes credentialing process. It gives me more knowledge and independence to care for my patients with diabetes and help to teach them to manage their diabetes themselves. So it gives me the time to do that with them, take some of the pressure off the doctors. Just having that knowledge to talk to them about all aspects of diabetes. You know, it's not all just about going on a diet or taking pills, it's whole lifestyle changes so that they can live a really happy, enjoyable life without diabetes having to take over it.
No, I'm really grateful for the scholarship because, you know, without the scholarship I probably wouldn't have gone back to uni to study, but it really helps my work here, and hopefully at the end of the day it will help improve outcomes for my patients as well.
I really am enthusiastic about seeing young Aboriginal people move into healthcare, but specifically diabetes care. The educational pathways are developing for them to do that, and I would like to see myself as in a mentoring role moving into the future. Actually, the scholarship has given me the opportunity to finalise my credentialing, and it's more than possible for Aboriginal people to become diabetes educators. I believe there's a very few number across Australia that have moved from Aboriginal health practitioner to a credentialed diabetes educator, and we'd just like to change that because it is a massive problem for our people.
The doctors will now come and see me and ask me, you know, what do you think of this? What do you think about that? So I feel definitely way more upskilled to manage my clients, and the clients get so much more benefit out of it as well.
Really, at the end of the day, it's overall so much better for the patient to be serviced in this way by wonderfully skilled practitioners and staff in general practice.